Hi, my name is Dr. Elizabeth Eversull, and today I'd like to talk with you a little bit about anxiety and some options for treatment of anxiety that don't include pills or pharmaceuticals such as Xanax and Klonopin and those type medications. Um, do you ever feel like you don't want to open that email? You don't even want to check that email. I don't want to go to the door unless he's bringing me pizza. I'm having kind of like a heavy chest, or I feel my heartbeat on the way to work, or I really don't want to walk out the front door to go to work. Just a sense of, ooh, something might happen, something bad might happen, and let's just not chance it. If any of that applies to you, well then keep watching, because I've got some options that we use here in clinic to help people with these problems. It's getting more and more common, and younger people, including children, are complaining of it. And so it's kind of scary, it's kind of concerning what's going on here. One of my personal hypotheses is that we're sort of overstimulated all the time, and our brains don't get to rest and just relax and sort of recover. All the time our phone's going off and dinging, and you're getting alerts from your email, and there's something else on the TV that's going and going. There's ads all the time about all the different diseases and the Armageddon of the world will end in 12 years if we don't do something, and so on and so on. So people have a lot of these complaints. Another reason I just forgot to mention is bullying, and people kind of having a little bit of issues with social media and manipulation and frenemies and all of that sort of thing. That seems to be a little bit more common too. So the ways that we treat these issues that are not necessarily what everyone else would do. One, I say it again and again, but our biofeedback is very, very helpful for anxiety. In fact, my most anxious patient, I would say, if you've ever had a panic attack or seen someone have a panic attack, her life is almost a static panic attack. It's dreadful. I mean, it's just, and we had tried all sorts of different herbal treatments, supplements, nutrition, different sorts of protocols for behavior, everything. And until she started using biofeedback, I'm telling you, game changer. The woman started snoring within a few minutes of using the biofeedback, and then has reported, of course she has insomnia too, and has reported 7 hours of sleep a night since she started maybe her second or third treatment, which is absolutely glorious. So she's done incredibly well. She's actually feeling like a different person. In fact, that was something that she said when she left from one treatment, is I am a different person, and it really feels that way. It's so gratifying to use that, because it's not a chemical, and there's not a side effect that I have to worry about with that. So I can't stress that enough. Another one is just some techniques that you can control yourself and be mindful of or aware of. As an example, there are certain patients, and there are many, that I won't let them watch the news. They come in with weight gain and tremulousness, poor sleep, brain fog, the whole thing. And as it turns out, they're addicted to the news, or they're addicted to shows that are like the news. And I have to stop it. I have to say no. A prescribed a sabbatical from the news. So that's one thing, is where you can just get a little bit of punctuated news, maybe once in the morning, read a little bit of an online post or something, and then be done, because people really get worked up with it. The other thing too is constantly checking the social media. Now, we're on social media, so I love it, but everything in balance. So people that constantly are checking to see what other people are saying and doing are always getting a little bit of every little hit that you get from that sometimes feels a little bit good, but it's actually a little bit of a stressor to your brain. And so being able to stop that cycle of constant feedback. It's almost like a rat on a bar, that you're getting a little bit of something, but then the rat won't stop hitting the bar, and that's anxiety for the rat. And we're the rat right now. So that's one thing. So getting a lot of the devices and everything kind of toned down. I have college kids that come to me, and they're absolutely wired for sound, can't turn anything off. And as it turns out, they've got their cell phone in their pillowcase as they're laying down sleeping because they're afraid they're going to miss their alarm or miss their test or their class or whatever it is. That is probably the worst thing you could possibly do if you have anxiety, depression, mental fog, any of those things, because that radiation, anything that's radiation, it's an exponent from how far away that you are. So if you're twice the distance from something that's creating a radiation, then you're getting a quarter or less of the actual radiation. So when something's literally on your head all night long, when you're most vulnerable in the sleeping condition, no, just absolutely no, I want to run around with my hair on fire about that. So we try to teach little things about that and other things that you can do while you're sleeping in terms of energetics. So that will help deepen the quality of your sleep. A lot of the anxiety, a lot of the brain fog. There's so many people that complain of poor memory and brain fog and do I have Alzheimer's and do I have dementia? Really, they're not getting sleep. They're not getting enough sleep, and they're not getting quality sleep because it's being interfered with by these devices. So that's the number one thing before you go down the path of worrying about your dementia, is to cut out all of the things that can really affect that. So that's one thing that I really love to do. I have some nutritionals that are very good in terms of anxiety. Some of the herbs, passiflora, and those sorts of things are very, very good for anxiety. Ashwagandha tends to be a little bit more of a yin treatment, very supportive for the recovery of the body, the adrenals. So there are options in that way. It's just sort of knowing which ones that person might like. The other option that I have is something that I really love. This it's sort of a little bit of a psychological purging a little bit, but it's a technique that I do one-on-one with the patient. And I'm not a therapist, I'm not a counselor, but it's a way for people to very quickly process sort of life traumas, and we all have them. If it's you got kicked on the playground when you were little, sometimes little bitty things like that can leave what I call little mental or psychological thorns in you. And when you go through and we can figure out the things that have actually caused you grief and have held you back, we can sort of pluck out those thorns very quickly without having to go down and talk about everything that's ever happened and so forth. So that's a one-on-one treatment that we do together, and it's wonderful, incredibly gratifying. I've actually had a couple of patients that came to me with all sorts of anxiety and all sorts of twirling out of the orbit, and I've done with one of them. I did one session of this. She told me at that time I'm a completely different person, and she meant it, and she was different from then on, and she didn't even come back until 7 or 8 months later to tell me that she was pregnant or something like that. But she said I didn't need anything else, which was fantastic. So that's another thing that I really like to use. And then if you have time or you have some other issues, I have a sauna that sounds weird. Why would you use a sauna for anxiety? But I have a very specific sauna device that it incorporates ozone, it incorporates a lot of different electromagnetic pulses, and it has something in it called carbonic acid, which is a gas that touches the skin before the ozone hits it. And people that have this sauna treatment, literally when you go in to get them out of the treatment, they are just absolutely like they've had a massage and a cocktail almost. So it feels really good, but at the same time it's really good for you, as opposed to the cocktail and all that. And so I really like to use it in conjunction with some of the other treatments, because they get a good detox out of it. They feel like they've gotten their heart rate up a little bit, but at the same time they're so relaxed. So it's kind of a different feeling than you are normally used to, but fantastic. So that's one of the other things that we love to use. We all use it here in clinic because who wouldn't like that? So if you enjoyed this video, if you got something out of it, please click and subscribe to my channel. Go to my website at handmadehealth.com or give us a call at 469-726-2737. Have a great day.